Good morning. I'm not Wouter van Bezien, I will replace him. My name is Veerle de Kalf and I have no disclosures. The aims of his study were to describe the prevalence of nocturia at home and during hospital stay in non-urgent planned hospital admission and to identify predictors of the number of episodes of nocturia while in the hospital. This was a single-center, cross-sectional study in people who were aged 65 years or older in these 5 nursing departments: urology, gynecology, plastic surgery, ophthalmology, short-stay surgery, thoracovascular and heart surgery, and gastroenterology, hematology, and pneumology. He used directed interviews with the Dutch version of the Nocturia on the Ward questionnaire, and medication and intravenous fluid infusion data were extracted from electronic medical reports. These are our results. He interviewed 142 patients. The half of them were male. The median age was 71 years, and the majority of them was independent of nursing aid for toileting. The prevalence in our study in the hospital was 49% and 42% at home, and with an incidence risk of 13% and a remission rate of 12%. We found no difference of episodes of nocturia in the hospital versus at home, and in this histogram you can see the change in episodes of nocturia in the hospital. So 30% of the patients did not have a change in episodes of nocturia, 32% had a remission, and 28% had an increase of episodes of nocturia in the hospital. These are the predictor factors. We used a binomial model where we saw that in the odds ratio, 14%, an increase of 14% of episode, an increase in 1 episode of nocturia at home gave a chance of 14% of an extra episode of nocturia in the hospital. Also for the number of voids during the previous day, oral fluid intake and lorametazepam use was a decrease of nocturnal voids in the hospital. These results should be taken with caution. It was a very young, relative healthy population with no overall change of number of episodes of nocturia while in the hospital, and this aligns with the understanding of nocturia being a marker of poor health. We did not find environmental factors that were predictors of episodes of nocturia in the hospital. However, we did not use objective metrics like frequency volume charts. Nocturia was only measured during the previous night only, and we know there is a known fluctuation of nocturia. We had a heterogeneous population who was a younger age and had a high level of independence. And of course, there was a floor effect from a low baseline of nocturnal toileting. In conclusion, incident and clinically relevant nocturia was rare in this population.
So can you tell us a couple of questions? Meanwhile, maybe somebody from the audience has a question, but we didn't find yet. So what kind of patients these actually were? That's one question. The second question, a little bit Finnish blunt question. Why did you do this study?
We did this study to see if the population of 65-year-old patients who were relatively young, if there is a problem with nocturia, with an increase of nocturia while they were in the hospital. So we want to see in the future which care we have to give to them so we hope that the hospital won't give them an extra episode of nocturia, and we saw that in this population it's not necessary to make other treatment plans or something for nocturia.
So what was the baseline for all these people? How many nocturia episodes did they have on average before they came to the hospital?
The median number of episodes was 1 episode of nocturia in the hospital. So it was not bothersome nocturia that they had.
And these were all people that were over 65, correct?
Were over 65.
Yeah, because the normally cited prevalence for people that are 2 or more at age 60 is about 20%, and 3 or more is about 10%. So isn't that number a little low for the overall population for 65 and older or not?
Probably, but we had a very healthy population. It was a planned hospital admission, so we don't have the people with a lot of comorbidities or in bad health.
So what was the main reasons for hospitalization?
Dus,
Main reasons for hospitalization for these patients?
surgery and medical supervision.
So surgery, I assume, without indwelling catheter, right?
No, those were excluded. Indwelling catheters, patients with incontinence also.
Okay. Okay, thank you very much.